Welcome to this evening's webinar on sleeping well and sleeping well with pain, which is a common issue that I see with a lot of my clients. And so we thought it was a great topic to talk about and to invite Janet to join us as she's a sleep coach. So my name is Miriam Mulkewich. I'm a registered physiotherapist and co-owner of Fit for Life Physiotherapy. So I've been practicing now for 28 years and see a lot of people who deal with pain and struggle with sleep. And so that is something that we talk a lot about, is strategies to help them find a comfortable place to sleep. And oh dear, we've just lost my presentation. Great way to start. Okay. We're gonna start. I'm not sure. There we go. I got it coming off to a rocky start here. I don't know why that did that. We've had a few little struggles in as Janet and I were getting ready for this, that the whole screen sharing thing was just not running very smoothly tonight. So please forgive us as we may have to deal with a few technical difficulties. So at any rate, that's myself. And Janet, if you want to just tell us a little bit about yourself and what is a sleep coach? Before I met you, I don't think I really knew that there were such a thing as a sleep coach.
Yeah, I thought I made it up, but it turns out it is a thing. It's becoming more popular, and many people might have heard of them in terms of baby sleep coaches, right? Like trying to get your infant on a sleep schedule that allows you to sleep through the night. But this is what I do is for adults and mostly women, few men now and then. But I really focus on helping people overcome their chronic insomnia. So we talk a lot about quality sleep, the physiology of sleep. So what's important for us to know? What are some of the myths? What do we think is true that really isn't, that might actually be keeping us awake, worrying about it? But yeah, I do focus mostly on insomnia recovery. Pain is a common thing that comes up though with my clients too.
Yeah, I can imagine. Okay, well, let's get going. So first, we want to talk about, well, what is the best sleeping position, or is there a best sleeping position? And I'm sorry to say that there's not sort of one position that I can say, okay, this is the way you need to sleep. Everybody is a little different, and it does take a little bit of experimentation to find what's right for you, but there's definitely some principles to keep in mind. And the first thing we want to consider is that you always want to maintain those natural spinal curves. And you'll see in this picture, this is a bit of a frontal side view. This is a side view that shows a little bit more at the back, and this shows the back of the spine. You can see in these views that show the side that there is a little bit of a curve. There's a curve here in your lower back that goes in, and then as you come up to your middle back, it curves out and then back in again up at the top of the neck. And it's in those positions that when those curves are maintained, that we have the least amount of stress on the joints, the vertebrae, the ligaments, the muscles, and so on. So we want to try to maintain that as much as possible in our sleep. So this is an example of, when you're sleeping on your side, of correct or better sleeping position and incorrect sleeping position. You can see on the top that the spine is kept in much more of a neutral position, whereas here with this big pillow, they're sagging down here. So that's not really a great position. And you can notice the difference between the top and the bottom here, that this top one, they have a pillow between your knees there, which then puts, a little less stress on the hip joint. So without that pillow, that bone there is being pulled down, which can pull a little bit on the pelvis and on the lower back. And if you've got pain in the hip, pelvis, or lower back, that can be a little bit uncomfortable, which is why the suggestion is then place a pillow between the knees. It keeps the hip and pelvis in a much better alignment. And pillows, that's a big question. Everybody asks me, what pillow should I buy? Because there are so many pillows out there. And, everyone's touting them, whatever pillow they're selling is going to be the best one, is the answer to your problem. And, unfortunately, again, it's not about any one particular pillow for everybody. It's a matter of finding the right one for you, because everybody's anatomy is a little bit different. Some people have more of a curve through their lower back, so maybe their head is a little bit more forward. And when you lay back, you might be tilting your head back without a pillow. And you can see that in this picture here, when the pillow is too low, you can see how this curve here in the neck is a little bit accentuated. When it's too high, we lose some of that curve. The head is pushed a little bit too forward. And what I always suggest to people is to kind of find out, okay, what's the right height for my pillow, or is my pillow the right for me? Is when you're lying down, is your chin poked upwards? And if it is, it's a little bit like this first position here, where you've got maybe a little bit more accentuation of that curve, as opposed to if your chin is really pushed down, then probably you're too far forward. You want to be somewhere in the middle where your chin is level, your eyes are looking straight up, not back and not down. So again, it takes a little bit of experimentation, and sometimes it's one pillow, sometimes it's two, sometimes it might be one bigger one and one smaller one. I'll often suggest to people as well with pillows is that they can take a small towel and roll it up and make a roll, and slide it in the pillowcase just underneath the neck here, so that it kind of fills in the hollows. Because when we want to maintain these curves, sometimes we just need a little bit of extra support, particularly when we're feeling some pain, that we want to support those curves. And having that little rolled towel can be enough to do that. And if you tuck it into your pillowcase, it won't slide away from you if you happen to be rolling around at night. So we'll come back to side sleeping. So when you're on your side, you can see, again, we talked about having that pillow between the knees. You want to have, again, the pillow underneath your head, not so much that it's pushing your head upwards, and you don't want to have too low of a pillow that has your head hanging down over a long period of time. That's going to be uncomfortable. Now, in this position, in this picture here, you can't really see that there is a little bit of a pillow or a folded blanket underneath the waist. And a lot of times I find that people who like to sleep on their side but are having some back pain will feel really comfortable with having something supporting, again, these curves here in that lower back area. So that's something that you can play around with as well. Sleeping on your back, a lot of people will find it, particularly when their back is painful, or if they're really stiff through the back or the hips, when they have their legs out straight, it feels uncomfortable for the lower back. And if you find that when you lay your legs out, that's just not the position you like, and you feel better when you bend your knees, it likely is related to tightness in these hip flexor muscles that are here at the front of the hip. Those muscles, now we don't see the muscles in this picture, but they start right here at the front of the lumbar spine, and then they come all the way forward to the front of the hip and attach here. So if they're really tight, when you're lying down with your leg out straight without this pillow here, it may pull on the lower back and pull you into a little bit more extension, which can be uncomfortable if your joints are a little bit stiff or if they're a little bit irritated. So having something underneath your knees just decreases the extension that happens at the hips and will take a little bit of load off of the lower back. Again, you'll see in this picture that there is a little bit of a cushion underneath the lower back. And again, that's to maintain those natural curves. And whether you use that pillow or not will depend on you. Some people find that that's really helpful to support those curves, and others, particularly if those joints are what's irritable, may not want that there. They're just happy to have a bigger cushion underneath their knees. And then looking at, again, the pillow under the head, that you're maintaining those natural curves, not too big and not too small, and just play around with finding that right height. So sleeping on your stomach gets a little bit of a bad rap, in the sense that everybody thinks it's really bad for your lower back to lie on your stomach. And it's not necessarily the issue with your lower back. I find it's more of an issue with the neck. In order to lie on your stomach, obviously you're having your head turned one way or the other. And, after a long period of time, that's probably not going to be comfortable. If you sort of imagine if you walked around all day with your head turned to one side for 8 hours, well, after 8 hours of sleeping on your stomach with your head turned to one side, probably isn't going to be too helpful. For somebody who does have limited mobility in their lower back, sleeping on their stomach is going to be uncomfortable because there is some natural extension that happens when you lie on your stomach. And if those joints are irritated, you're not going to like that position. And this is where, to help with that, is having, again, a little bit of a pillow underneath your pelvis and your lower back. Because what that will do is that will take you out of that slightly extended position into a little bit more of a neutral spine, and will be a little bit less irritable to those joints. I find if you really are a stomach sleeper and love sleeping on your stomach, but just can't sleep on your side or your back, I often will suggest sleeping in a bit more of a semi-prone position. So you need a couple pillows to help you with that support the front of your. So if you have a long body pillow that can be underneath your chest and your belly, and so that when you're lying down on it, your head is not face forward into the ground, but you can keep your head in a more of a neutral position rather than turned one side or the other. Unfortunately, I don't have a good picture that describes that, but something, again, to play around with if this is a position that you really love to be in, but is bothersome for your neck. So those are some ideas about how to find the best sleeping position for you. And again, it really is a little bit about trial and error and using pillows, lots of blankets, that kind of thing, to find the support that you need. And this, dealing with chronic pain and sleep is a bit of an issue, and it becomes a little bit of a cycle. That when we're dealing with chronic pain, yes, we have a hard time finding a comfortable place to sleep in, trouble staying asleep, which means we're not getting, good quality sleep, which has an impact on how our body is able to heal, which then potentially leads to more pain, more difficulty sleeping, and here we go round and round in a circle. So how do we stop that vicious cycle? So first, we need to understand a little bit about how does pain affect our body. And to talk about that, we want to talk a little bit about the autonomic nervous system. So the autonomic nervous system is something that functions without us controlling it. It deals with things such as metabolism, our circulation, our breathing, body temperature, our digestion, immune response, reproduction, our hormones, all of those kinds of things that we have no conscious control over, but are obviously very important to our survival. There are two aspects of the autonomic nervous system. The sympathetic nervous system is what's known as our fight or flight response, our stress response. So it's what mobilizes our body for action when we're afraid, that kind of thing. So, it's what gets you going, that adrenaline to run away from something when you're in a scary situation, for example. Some of the things that happen with the activation of that sympathetic nervous system is that we might feel a bit of an increased heart rate. We might feel an increased breathing rate. We might feel, some sweatiness, muscle tension, all of those kinds of things. The parasympathetic nervous system, in contrast, is our rest and digest. It's what brings some peace and calm to the body. It's the state that our body needs to be in to rest, for our bodies to digest food, those kinds of things. And it's when this state is a little bit more active where we see a decrease in heart rate, a decrease in breathing rate. And so what does that have to do with pain? So when we're in pain, it actually does have an impact on the sympathetic nervous system in that it tends to activate that sympathetic nervous system. And it's a form of stress. And it can do all of those things that we talked about increasing muscle tension, increasing heart rate, increasing our breath rate, that kind of thing. And for a lot of us, we are living in states of chronic stress, not just because of pain, but because of the lives that we live, right? Our busyness of getting to and from work, dealing with traffic, all of those kinds of things. And when we get into those states, we get into what I kind of call a sympathetic driven breathing pattern, where when we breathe, we tend to breathe more into our chest, into our shoulders, which is not a very calming breath. And a lot of times, if you imagine that, when you have sort of an increased sensations of pain, or you're going through an acute bout of pain, you probably do notice that your breath pattern changes, that it gets a little quicker and a little shallower. So that is much more of a sympathetic driven breath. And our parasympathetic system is not active enough, that we're not able to kind of access that peace and calm that we need. So what can we do about that? Because I just finished saying that the autonomic nervous system functions without us doing anything about it. So, how do we have any impact on that? And one of the ways that we can impact that autonomic nervous system is through our breath. When we have a calming breath, a deep, slow breath, that will activate our more parasympathetic nervous system and decreases that sympathetic dominance. So the benefits of that long, slow breathing, and in yoga, it's referred to as pranayama. And there's a variety of different breathing techniques and patterns that you can do to achieve this. But there are a lot of benefits for general health as well as for pain and for sleep. They improve pulmonary and cardiovascular function, enhancing well-being, mood, attention, mental focus, stress tolerance, improving our immune function. And it does enhance that parasympathetic activation and decreases our sympathetic dominance. So when people are dealing with pain, is one of the things that I often will focus on is looking at what are their breathing patterns, and looking at, do they tend to breathe more through the upper chest, or are they breathing through the diaphragm and through the lower ribs? Do they tend to hold their breath a lot? And these are things that you might just kind of check in with yourself on throughout the day and notice what your patterns are. I find a lot of my clients come back to me and say, wow, I hold my breath all the time, and they didn't even realize it. And with that comes a lot of tension, and it just sort of reinforces that sympathetic breathing pattern. So in order to have an impact on pain, we can really focus on breathing and finding that slow breath, because we know that that will influence our autonomic nervous system, particularly our parasympathetic nervous system. So while that slow breathing may not be able to change the source of the pain, it can change your experience of the pain. And that is what is really important. So some breathing practices that you can try is a diaphragmatic breath or a lateral costal breath. And if we think about where our diaphragm lives, it lives right underneath our rib cage, right at the bottom there. So if we're breathing just up into our chest, we're not really getting full advantage of that diaphragm muscle, right? So we really want to feel not just the belly rise, but even the ribs expand out to the side. I will often refer to it as an umbrella breath. So if you think about your rib cage like an umbrella, that lower part of the rib cage is a bit of a dome. So when you breathe in, the umbrella opens, and when you breathe out, the umbrella closes. And so if you can have that visual, it helps to really focus the breath down to that lower part of your rib cage and take away the focus from the upper. So this person here, you can see the picture, he's got one hand on his chest and one hand on the belly. And I would suggest having your hand, the lower hand, not just over the belly, but the lower part of the rib cage, so you can feel the ribs expanding as well. And just take a few minutes to just tune into, how do I breathe? and don't try to change anything, but just sort of focus on what is it that I do. And you might notice that, wow, I do, like, you know what, all my breath is coming here. Or maybe perhaps it is all going down to the belly or the ribs, or maybe it's just kind of all happening all at once. But first, noticing before you try to change anything, figure out what your natural pattern is. And that's where you'll just gradually try to sort of send the breath towards the lower rib cage. I'll often suggest to people to place their hands on the lower part of the rib cage, and just, if you sort of imagine, okay, I want to breathe into my hands, give yourself a little bit of some physical touch so that you have a sense of what you're actually breathing into. The other important thing about your breathing practice is it's a long, slow exhale that is most important. You know, everybody tells, okay, just take a big breath, you know, make sure you breathe. And we all know that breathing can be helpful for relaxation, but it's not necessarily about that big inhale. It really is about a long, slow exhale. That is the piece that is going to calm your autonomic nervous system and really activate that parasympathetic nervous system response. So again, just kind of check in with yourself. What is it that you do naturally? That if you just count your breaths, so how many counts does it take you to breathe in? And how many counts does it take you to breathe out? And ideally, I would say you want to be able to breathe in for 5 or 6 counts and breathe out for 5 or 6 counts. If you're finding that you're only able to breathe in for 3 and to kind of extend it to 5, it feels like you're really struggling and having to force it. You do want to sort of then gradually be able to expand your breath, but don't force it. You want it to be relaxed. In those situations, if you really find, man, I can't do a longer breath, it just is not physically possible, that's where I look at, well, what's the mobility like through your spine? What's your thoracic spine mobility? Because that's where the ribs attach. So we look at then some mobility exercises to improve that mobility, to allow yourself to be able to take that nice big diaphragmatic breath and not feeling like, okay, I can only breathe into my upper chest. So those are things that we would work on to help you to be able to achieve that nice calming breath that we want to help with pain and help with sleep. The other two breathing practices that I've listed here, the square breath is something that you might try just in those moments of where you're trying to kind of find some calm and really relaxing yourself. And what the square breath is that you would breathe in for a count of 4, pause for a count of 4, breathe out for a count of 4, pause for a count of 4, and then repeat that cycle and keep repeating it. So those 4 counts are your square, your 4 up, hold across for 4, breathe out for 4, pause for 4. And that can be a really calming breath. And what I also find is because your mind is focused in on the counting, you can't think about anything else. And sometimes that's a really important piece in all of this, because we have so many other things on our mind that it's hard to let that go. So that's one practice that you can try. The other is alternate nostril breathing. And what that is, you'll see in this picture here that she's got one finger blocking her nose on the other. And then you would breathe in through one nostril. And then when you breathe, before you breathe out, you're going to switch to the other side and breathe out through the opposite nostril. And there actually is some evidence that shows that this alternate nostril breathing does have an impact on calming that autonomic nervous system and activating our parasympathetic nervous system a little bit more. So these are some strategies that you can try for breathing practices. And if you find that, you try them out and you just don't feel like you can get it right, then certainly, talk to somebody who has some experience in that to help you out with that. So some general tips to sleep well with pain. The first thing is really finding that comfortable sleeping position that supports those natural curves of the spine. And, I'm sorry to say that I can't say, get this pillow, get this mattress, it really is very much a personal thing, because everybody's body is slightly different, right? Our anatomies are a little, and we're the same anatomy, but we have different idiosyncrasies, right? As far as what some areas are tight or not tight, or we have greater accentuation of the thoracic spine for some, others don't. That has an impact potentially on, how many pillows we might need to use under our head or under our knees. So the other thing, and I hadn't mentioned this until now, is just incorporating pain relieving movements at bedtime and during the day. So if you've been working with a physiotherapist about your pain, oftentimes they'll have helped you find different postures and positions that unload those structures that are causing pain. And when we've had, say, a busy work day where maybe you've been either sitting too much, standing too much, whatever it might be, we do want to use those movements and postures throughout the day to unload those structures so that we don't let that pain build throughout the day. And so particularly before you go to bed is a good time to do it, particularly if you do find in the mornings that you're waking with a little bit more pain or a little bit more stiffness. I'll usually say you definitely need to then address your sleeping postures and positions, but trying some movement before you go to bed to move those areas that are causing you pain. And the other thing is to take some time to breathe and to really focus on that long, slow breath. So at bedtime for sure, but you might also want to take that time during the day. If you've had a really busy, stressful day, it might be hard in just 5 or 10 minutes right before bed to really calm the nervous system when there's been so much buildup going during the day. So it is something that you want to kind of find some pockets of time to just breathe and calm that nervous system. So with that note, Janet, I'll let you take over. So I'm going to stop my screen share and let's hope that we get this transition right, because we had some difficulties with it earlier. So I'm going to stop the screen share and we'll let you take over.
All right. Cross your fingers, Miriam.
All right.
You see me? Okay.
I see you.
Excellent.
Please let us know if you're not able to see Janet's screen. And actually, before we go on, Janet, is there any questions before we move on to what Janet has to say? If there are, just please pop them in the chat. And if you think of some later, again, we'll get to them later on. All right. Take it away.
Okay, so I'm really glad you were talking about what we can do during the day to relax our nervous system, Miriam, because sleep is in fact a 24-hour thing. We don't often think of it in this way, but our circadian rhythm is really based on this 24-hour cycle of light and darkness and different hormones and our body temperature, right? So if you are struggling to sleep, what I really want you to come away with today is that we need to be thinking about this from really the minute we wake up in the morning, not when we're about to put our head on the pillow. And that's because we'll talk about this a little bit more, but we have expectations about how our behavior should be working for us. And if we wait for the behavior to happen right before we go to bed, we could be creating a bit of a problem for ourselves. So we talked a little bit about this at the beginning, but I just wanted to cover off, like, what is a sleep coach? Because most of you probably don't know. One of the truths we know about insomniacs, and I do talk mostly about insomnia in my work, is that we have a lot, and I include myself in this, although I call myself a good sleeper now, but I was an insomniac for about 40 years. And like most other people who struggle with this problem, we have a lot of unhelpful beliefs about sleep. They're supported by the media. We're told all kinds of stories about sleep and the problems that we'll have if we don't sleep, but no one really tells us, what does it really mean to sleep well? And so therefore we all have a bunch of different ideas about what that looks like. And just like we have, slightly different body builds and structures, the way Miriam was talking about how your anatomy might be like structured just slightly different from someone else, your need for sleep is also very different from someone else. So we want to make sure that we're not comparing ourselves to someone else. We're not, I always say insomniacs find great sleepers as partners, and I don't know how that happens, but it always seems to be true. So we don't want to compare ourselves to our partner who we maybe share a bed with, because our expectation is going to create some stress for us that might make it even harder to sleep. But my goal is to help you sleep restfully and naturally, and using really just your brain as a tool. And I'll get into that in just a minute, what I mean by that. If you have ever struggled with sleep, you, like most people, have probably Googled something like, why can't I sleep? Or, good sleep habits or healthy sleep or something like that. And you've probably come across the most popular sleep advice on the internet, which is something called sleep hygiene. And so I wanted to talk about that in terms of insomnia, because I think these things get confused. And I'll just also share a little caveat here that everything I'm going to talk about tonight is really for people who are struggling with chronic insomnia. If you are not one of those people, don't change anything. If you're sleeping well, don't question it. Don't think about it. Don't think that you should be changing a tool or two. Really, the best sleepers don't ever think about their sleep. If you ask someone who's a great sleeper what they do to make it happen, mostly they'll look at you like you have two heads, because they just really have no idea. And that's kind of my goal for my clients, is to get to a place where you just don't have to think about it anymore. We take way too much time in our day worrying about this. But sleep hygiene are the kind of tips that you might read, like sleep in a cool, dark room, have a consistent bedtime, don't eat within 2 or 3 hours of going to bed, don't exercise within 2 to 3 hours of going to bed, no caffeine after noon, comfy PJs and pillows and all of that, which is for pain in particular, really important. Having a clutter-free bedroom so that you decrease your stress that way, and no screens before bed. And I'm sure that most of us have heard that list or some version of it at some point, right? And I'm not going to suggest that those things aren't important, because they are very important for all kinds of different reasons, some more than others. The problem with looking at that sleep advice, if you are someone struggling with chronic insomnia, is that that advice is meant to help good or decent sleepers sleep better. It's not really intended to help you recover from insomnia, because insomnia is a completely different thing. And it's not really, this is going to sound very strange when I say it this way, but it really doesn't have a lot to do with sleep itself. It's really a fear of being awake when you think you should be asleep. Right? It's your brain's opinion about your sleep. Almost every human struggles with some version of insomnia, acute, which is just sort of like once in a while. We'll talk about that a little bit more at one point or another. And it's actually not an abnormal human thing to have struggles with sleep once in a while. So I really want you to know this, because I think what happens is people look on the internet, they see those tips, they go, okay, I've done it all. I've set up my bedroom, I've done all the things, and it's still not working. And then you start to think something's wrong with you. And that's really not true. And so I want you to look at this as more of a, not that those things are bad, because they're not, but they're sort of the secondary thing that you should be thinking about if you're struggling with chronic insomnia. Those tips also don't get to the root of the problem, right? They're a bit of a Band-Aid solution, because they're not helping you resolve the chronic stress, or the thoughts about sleep, or the thoughts about your day tomorrow, or the real worries that are keeping you awake in the first place. Like I said before, it also makes you feel worse when it doesn't work. And I really just want you to not have this feeling that there must be something wrong with me. A lot of the, I always say I will never market my sleep coaching by telling you all the health, concerns that could happen to you because of insomnia, because really that's just going to create more insomnia, right? The last thing we want to be worried about is all the terrible things that could happen if we don't sleep enough. Most of us have gotten to a certain age having some insomnia now and then, and we're doing okay. So we really want to focus on that, right? We want to focus on how we have overcome some challenges and how we have managed to not push through, but how we have managed to still get through our day the next day. There's all kinds of studies actually that show that for people who are motivated to get something important done the next day, that there's very little cognitive impact or impairment related to poor sleep the night before. And they did these studies on emergency room doctors and transatlantic solo yacht racers, like people whose lives are really tied to being able to do their job and do it well at a moment's notice, even if they're a little bit underslept. So we can, what I hope you'll take away from that is that we can probably relax a little bit on some of the fear around the health impacts so that we can take a more objective view of our sleep and what's really going on. The other thing that most of these sleep hygiene tools, not all of them, but a lot of them, tell us or have in common is that they're external to us, right? They might be things that you have to buy or plug in or ingest. They're not things that we can just sort of control with our brain and our thoughts and our nervous system. And so let's say, you go buy a weighted blanket thinking that this is going to help you with your anxiety, and then you go on a vacation and you can't carry it with you because it weighs 15 pounds or something. You're going to think, I can't sleep. So I'm going to get into now why some people suffer from chronic insomnia while other people can have trouble sleeping now and again, but it never really becomes a chronic problem. And then how we really need to be able to think about sleep to avoid those cycles starting and continuing. And then I'll give you a couple tips at the end that you can just take away tonight and start right away. And they might even help you. A friend of mine was going to come tonight, and she emailed me earlier and said, I'm not going to come because I realized I've just been over caffeinating for a couple of weeks and I think I've solved my own problem. So it might be as simple as that for you, but I'll give you a couple other tips as well. Okay, so this model of chronic insomnia was created by a neurologist named Dr. Arthur Spielman in the 80s, I believe, because he had so many patients who were coming to him saying, like, I have this chronic insomnia problem, and he would compare them to other patients who seemed to have kind of similar lives and similar outlooks, and he just couldn't figure out why some of them had this chronic problem while other people were able to kind of have a few rough nights here and there but get past it. And so what he realized is that there's what he called the 3 Ps of insomnia. And this model, there are many models studied for insomnia, but this one has really kind of stood the test of time. And I think because it's very simple, it'll make a lot of sense to you when I'm finished. But the 3 Ps stand for predisposing factors, precipitating factors, and perpetuating factors. I'm going to get into each of them separately. Predisposing factors are things that obviously predispose you to insomnia. So they're things like your family history. They might be a medical disorder. They might be some social factors, like certainly poverty, homelessness, trauma. All of that can lead to quite long-lasting issues with sleep. There are absolutely medical, biological sleep disorders, narcolepsy, sleep apnea, certain seizure disorders, chronic pain, which we've just been discussing, restless leg syndrome. All of these things can predispose you to having a challenge with your sleep. And they're not likely to be resolved quickly, right? You might have suffered with some of these things for your whole life, or they run in your family, and they're not something that's just going to go away tomorrow. So this is a little bit more challenging, right? And this is not an area where probably sleep coaching is going to be helpful, because it's not like you can just think these things away. They're actual real physical issues, and they need to be dealt with in a different way. But as we start to get into precipitating and perpetuating factors, this is where sleep coaching can really be helpful. So precipitating factors for insomnia are the things that happen to us that trigger our stress. So they're things that are around us in our environment, right? They're not necessarily happening internally, so they're not a physical problem for us, but they could be I should restate that, because it could be an acute injury, right? Like it could be something that maybe you've broken a bone, or you have a back injury or something like that, that you know is going to recover, you know is going to get better, but right now it's really stressful and really painful, and it's really affecting your life. It could be a divorce. It could be even something as seemingly happy as having a baby or getting married. Even a positive stressor like that can have an impact on our sleep, because it's changing the way that we do our day, right, and our evenings. And then, so when we think about the difference between this and a predisposing factor, these are events that will get better, that will go away, right? They'll change, they'll evolve. No matter what we do, these things are going to change. So maybe if you lost your job, you're going to get a different job, right? You're not in a permanent situation here, but your brain is telling you that this is a period of high stress. And unfortunately, our brains aren't very good at unwinding a high stress once it's there. And so when Miriam was talking about, the sympathetic nervous system and how it is there for a good reason, right? To tell us when there's a saber-toothed tiger outside of our cave that is going to eat us. We want to be able to engage our fight and flight so that we can leave, so that we can get away from that saber-toothed tiger. Unfortunately, with the precipitating factors, some of which are more of a psychological concern or worry, our brains just don't know how to come down from that sort of high, constant hum of stress. And so then we get into perpetuating factors to try and deal with that, because we don't necessarily know or have been trained how to engage our parasympathetic system and how to do the breathing exercises, etc. We do these other things. We create crutches, almost like anxiety crutches, right? We get prescription medications, even over-the-counter medications and supplements would be included here. I know a lot of people think that they're harmless, but there is some evidence that some of them, even melatonin, cause nightmares, headaches, grogginess the next day. And melatonin is actually not really ever been proven to, it doesn't act as a sleeping pill. It's not to be used the way that kind of the media and your friends down the street have led you to think that it's appropriate. So we just want to be careful with anything that we're in, like I said before, ingesting or plugging in or buying, right? Sleep tracking devices is another one. So your Fitbit, your Oura Ring, your Apple Watch, any of those things that are marketed as things to help you track your sleep, they're often a little bit inaccurate. Even the best ones are known to be off by about a half an hour a day. But aside from that, you probably don't know what to do with the data that they're giving you, right? So if you don't really understand what REM sleep and deep sleep are supposed to do for you, or you don't really know the amount of time that you're supposed to be in those sleep phases, or when in the night those sleep phases actually happen for you, if you get data that tells you, you only had this much REM sleep and you don't know if that's appropriate or not, what are you going to do with that information? What happens is it's actually causing a new sleep disorder called orthosomnia, which is getting a little bit too addicted to your sleep device and the data that it's giving to you, and obsessing about it to the point where it's actually creating more insomnia than not. But some of the other things on this list might be a little surprising for people. Blue light blocking glasses are getting a lot of focus lately because of the light from our screens. And like, certainly if you're holding a screen up to your face like this, right before you're falling asleep, that light is pretty close to your eyes, right? And it could be actually enough to trick your circadian rhythm into thinking that it's morning and shutting down melatonin and increasing cortisol. And you don't want that to happen at bedtime. But even more importantly, we don't want to be on our screens because of the stress that creates. It's the things that we're reading when we're looking at our screens, when we should be going to bed. And it's all of the decisions that your brain thinks it has to make while it's looking at those screens. So if you think about any media that you're reading on there, it's probably got like a bunch of hyperlinks. It's got little pretty buttons that you can push. Maybe there's something that you think you should buy because it's really great and you won't remember tomorrow. All of those little things represent decisions for your brain, and decisions are exhausting for our brains. And so this whole experience of scrolling around and seeing news and making decisions about what to read next is actually creating stress. So that is actually more important than the UV light that may or may not be keeping you awake. I just have to move these little pictures here so I can see the rest. Going to bed earlier is another thing that I think we're trained to think is a good idea in order to resolve our poor sleep or our sleep challenges. But that actually can cause a bigger problem than not, because most insomniacs actually spend too much time in bed, not too little. And we spend too much time in bed awake. And if you go to bed before your body tells you you're drowsy and ready for sleep, you're just going to probably lie there and toss and turn and get really frustrated. And that will further condition your brain to see your bed and your bedroom as a place where you would lie there frustrated, not where you sleep, right? So there's a lot of ways that we can overcome that. One of them is to just get out of bed once you find yourself getting frustrated and wait for yourself to be tired again and then go back to sleep. But sometimes that's a little more challenging. We're not attuned to a lot of our body's signals anymore around sleep, right? We kind of push away drowsiness. We don't listen to it. We don't give in to it. We go, I don't have time for this right now. I'm too busy. I have emails to respond to, and so on. Sleeping in on weekends is another one. We are trained to see this as a treat, right? This is something that we reward ourselves with. We look forward to it. We think it's actually a great thing because we believe in this myth that we can catch up on sleep, which we can't. The other thing that happens with that, though, because again, our circadian rhythm is a 24-hour process, and it wants consistency. It wants to see the same thing happen every day. And we've just experienced this with the bouncing forward an hour, right? A lot of people I've seen on the internet complaining that they're only after 4 or 5 days now are feeling like they're a little caught up with having lost that hour. Catching or sleeping in on the weekends does really the same thing as the time change. It's the equivalent of flying. Let's say you normally get up at 7 on a weekday and you sleep in until 10 on Saturday and Sunday. It's the equivalent to your circadian rhythm of flying to Vancouver every single weekend and then having to manage that time difference, right? So it creates like a lifestyle jet lag. It's like a jet lag to your body, and it just takes it takes several days to recover that. So by the time you're recovering, it's the next weekend and you're doing it to yourself again. So if you can I'll get to this tip later, but if you can avoid sleeping in, it's a really good idea.
So Janet, quick question about that. So if you sort of feel like, well, because I'm, if you're getting up at 6 all the time, right? Is that really what time? Like, what's the length of time that if you sort of say, no, I just want to have a little bit of extra time in bed? Like, is it like, could you say, no, I'm going to sleep for another half an hour?
Half an hour.
That's still okay.
Half an hour would be the maximum that you want to sort of play with there. Yeah. And like eventually it might feel a little rigid to you at first because you're used to having like a bunch of sort of loosey-goosey flexibility. And a lot of us have a thought about that too, right? That, well, I should be able to do that. I like to have that flexibility. And
Yeah.
then I just sort of say, well, how's that working for you?
Right.
You might like that mentally, but your body really doesn't like it.
Right. So
Yeah.
someone just asked a question as well. What would you suggest for someone who works days and nights and has to constantly flip and back and forth? Sleeping in the day is very challenging.
Yeah. So shift work is really challenging for sleep. And I'm not going to sugarcoat that. It's almost like that's an outlier, that there are things that we can do, and you actually have to be a little bit more rigid than the average person with your both your sleep hygiene and your kind of your pattern of your day. If you know that you're switching back and forth, and it's going to be an ongoing thing. We don't unfortunately have like quick fixes for shift workers. It is a challenge. So the biggest thing that I would say about it is I guess I would ask this person, once you're on one shift, are you on that one for like a week, or does it shift like every other day? Because my advice will be different. But let's say you have, say, a good week, right? You want to shift into that schedule as quickly as possible, like on the first day, and stay with that schedule very consistently and really don't waver from it. And you're going to benefit a lot from the like guided relaxation exercises and getting sunlight in your eyes at different times of the day. So for most people, you're going to want to get natural light in your eyes like first thing in the morning.
Yeah. So she's saying it's 2 days, 2 nights, then 4 days off.
Okay. So that's really challenging. And I really wish that I had a better solution for you. But it's sort of like, if you're a business traveler and you're traveling time zones like a lot, the best advice they give you is get yourself into the new time zone immediately. Don't try to pretend it's your old time or, whatever. Really just live in the time that you're in. And for you, melatonin might actually be helpful. And this is the only place that I would actually suggest this. It works for jet lag, and it also works for shift work, because your body needs to have the melatonin at a different time than the sun is telling you, right? So yeah.
And interesting, someone also made a comment that melatonin does the opposite for them and they end up with hyperactivity.
That could actually be. I'm going to pull out a book right now to give you, because I'm pretty sure there is a shift work section in this book that I think
Can you say what it's called?
Is it backwards? Okay. Say Goodnight to Insomnia, and it's by Greg D. Jacobs. And he's the gentleman I did my CBTI training with. CBTI is cognitive behavioral therapy for insomnia. And I'm pretty sure there's a section in there on dealing with shift work, but it is not a magic solution, I'm afraid. It's a challenging struggle. And then on those 4 days you have off, I would try to stay consistently with one or the other of the schedules as much as you can. Like, don't shift, don't go to one, then another for the 4 days, and then a different one. Like, stick with either the last shift that you were on and make it 6 days, or shift to the 2 day that's coming up, so that you have a good 6 day period where you're sleeping in the same schedule, if that makes sense. Did that make sense the way I described it?
I think so.
Okay. You want to have as many days in your week as possible be the same,
Right.
so that only 2 of them become your outliers, instead of like 2, then 4, then 2 more, right? You want to have yeah.
Right.
Okay. I hope that answered it. But yeah, consistency is king there. So chronic insomnia is not usually caused by external factors that you would see in the precipitating factors, right? Precipitating factors creates acute insomnia. And I'm going to define insomnia here for you so that you know exactly what we're talking about. Insomnia, chronic insomnia, is defined as having trouble falling asleep, staying asleep, or waking up too much before your alarm. And in any of those scenarios, it's 30 minutes. So if it takes you longer than 30 minutes to fall asleep, if you wake up in the night and it takes you more than 30 minutes to go back to sleep, or you wake up more than 30 minutes before your alarm, and this happens 3 times a week or more, and it's been happening for 3 months, and you are complaining about it, it's impacting your life, then you can say, I have a chronic insomnia problem. Okay. And the biggest factor in there is the complaining about it part. Because if we're not complaining about it, it's probably not a problem, right? Like there are some people whose sleep is just all over the map and they don't care. It doesn't affect them one way or the other. So if you fit that scenario, then it's really probably something that you want to be looking at. It's also, like I said before, not a nighttime problem. It's a 24-hour problem. And so it has a 24-hour solution. It really is about chronic stress and learning to manage it mostly during the day so that we're not carrying it into our bedroom at night and expecting something to have, like, I think of sleep as a dimmer switch, not an on off, because it really requires time for your body to shift between your sleep cycle or your sleep system and your wakefulness system. It's not an automatic thing. So we really need to address that chronic stress that leads to the insomnia starting in the daytime. I give clients guided, I'm also training to be a mindfulness meditation teacher. And so mindfulness has become a big part of my program recently. And we also do a lot of guided relaxation, and we start with it during the day. We don't even bring it to our bedrooms until several weeks into the program, until you're really building a habit of looking at your stress and trying to notice that you can actually calm your body down using the power of your brain. And then we also do a lot of educating on sleep and insomnia. So what helps, what actually hurts it, and what we don't really need to worry about, which is what I was saying before. I think I've covered most of this, and Miriam has too. That pain and insomnia have a lot in common, and so they have very similar ways out of the problem. Miriam was talking about breathing exercises, and yoga is really helpful for sleep. Yoga and stretching, yoga nidra, mindfulness meditation, guided relaxation, all of that, anything that helps your nervous system to calm back down and get out of that state of fight or flight is really important. But part of this, in my work anyway, we do with what I'm going to call thought work. And what I mean by that is addressing our inaccurate thoughts and beliefs about sleep, because our habits really come from our beliefs, and our beliefs are just thoughts that we have over and over again. Okay. Our brains offer us something like, nobody's ever been able to actually measure this, but we think it's something like 12,000 thoughts a day. And if you think of that like the ticker tape that's just like constantly going in front of your consciousness, right? Most of them are very negative. We've evolved with this negativity bias to keep us safe. And they're overly dramatic and scary a lot of the time, but we can choose to think more helpful thoughts and more accurate thoughts about sleep. So I'll give you two that we can work on. One is that the 8-hour sleep myth. We all don't need 8 hours of sleep. This is surprising to most people to learn that actually 7 is probably considered the most healthy for the average person. But it could range anywhere from 6 to 9 hours. And you really do have to sort of use your body as an experiment over time to see what really works for you. And then, of course, we talked about sleeping in to catch up. We can't actually catch up on lost sleep. Our brain, it's interesting I say that, but our brains will actually catch up on lost REM and deep sleep. You may not think like, what it'll do is it'll take the amount of sleep that you actually got and sort of fill it with more REM and deep than it would have normally, if that makes sense. Most of your night is actually spent in light sleep. So if you have a rough night one night, the very next night, your brain's probably going to compensate for that with a little more deep and REM sleep than light, and then probably get you back on schedule the other way. But you won't kind of notice that, and you won't think it happened because you maybe didn't get any more sleep. So most people think of catching up as more sleep, right? It's not really what's necessary. So we need to learn to observe these thoughts that our brain is offering us up here, where it's just the ticker tape. And then we can interrupt them and replace them with, I don't like the word positive, because this isn't like a cut and paste project where we just cut out the bad thoughts and put in a new one. It's not like that. It's more, how can I think that if I think this way, I feel terrible, and then this is what happens. But if I think this way, it actually gives me a more confident feeling, and then I feel better about doing something different that actually benefits me. And then you kind of watch that pattern, and what happens is your thoughts and your beliefs evolve, your thoughts and your emotions, right? So some of these thoughts are things like, I'm never going to get to sleep tonight. Tomorrow's going to be a write-off. I'm never going to get through the day. Why am I awake again at 4 o'clock? That means I only have 2 hours left to sleep, and that's not enough. And you start doing math in your bed, which I forbid in my program. And eventually you end up with, there must be something wrong with me, and I'm just not meant to be a good sleeper. And I'm a testament to the fact that that's just not true, because I resolved 40 years of this kind of thinking, and now sleep much better than my husband. And this process, by the way, is evidence-based. It's studied. CBTI is the program that my program is based in, but it's also, we do a lot of mindfulness and life coaching in addition. So it's kind of an amalgamation of several different approaches. But there are many, many studies and medical journals where CBTI has gone head to head with Ambien, and it beats it every time. So for immediate resolution and for longer term. So you can rest assured that this is all based in science. It's not sort of woo-woo made up stuff. So my program is called Permission to Sleep. I'm not going to go into this too much because I see it's 8 o'clock, but we're really dealing with like the strategies and the habits that condition your brain to, first of all, convince you that you're an insomniac and there's a large problem here. And also that your bed is a place to fall asleep and be relaxed, not a place where you toss and turn. Okay. So I'm going to give you these 3 tips quickly. You want to stop sleeping in on weekends and wake up at the same time every day, 7 days a week. This is much more important than your bedtime. I know there's a lot of focus on bedtime routines and what time you should go to bed. I only want you to think about bedtime as when I'm sleepy, when I think I could actually lie down and fall asleep. Am I yawning? Am I reading the same line of a book over and over again? Am I stretching and like not able to kind of focus on a conversation that I'm having, right? All of that is much more important. Bedtime is about being drowsy and falling asleep. Waking up is to be consistent 7 days a week. I want you to start paying attention to the things you say to yourself about your sleep, right? This is how you can learn to think more helpfully about yourself, about sleep, and your ability to kind of get through the day when you have a not so great night, right? There's always a more helpful way to think about this. And then finally, this one's probably the most important, and this could solve it for some of you right away, is to get natural light in your eyes every single morning as soon as you can. And of course, I'm not talking about shift workers here, because I think you're going to need to kind of massage what time of day you get this light in your eyes. You might want to actually do it around sunset, not sunrise, like someone with a consistent schedule would. But if you can combine that with like a short walk, and we need less for sleep, we need less exercise than we think we do in order for it to benefit you. So even just like a 20-minute walk outside, and just not even a fast-paced walk, just some exercise. You can combine those two. They are the best natural sleep aids, and that's what you want to start doing right away. So I don't know, do you want to take over here, Miriam?
Sure. I just wanted to just make a comment about your 3 tips. I know your tip number 2 about changing your thoughts about the stressful things we think about. Oh my God, tomorrow's going to be such a crappy day. And coming from somebody who's dealt with chronic insomnia for a long time, those changing those thought patterns really made a difference for me, for sure.
Yeah, for me too. I had an overriding belief this is a terrible thought, but I used to think sleep is for chumps because I couldn't do it. So my brain needed to have some kind of reason why this was happening to me and not other people, right? So I made up in my head that I just didn't need as much sleep as other people, and that other people were wasting a third of their life in their bed. That's what I thought. And now nothing could be further from the truth.
Right. So yeah, in order to connect with us, if you have any, to connect with me, if you have any issues with pain and you're really having a hard time finding those comfortable positions or finding those movements that give you some relief, or if you sort of, as you start to evaluate your own breathing patterns, you kind of realize, man, I have a really hard time breathing through my diaphragm. We can work on developing, some movements and exercise that you can do to help improve that mobility so that you can move a little bit better. I have done my yoga teacher training, Pilates long before that, but as far as, as for the breathing, I incorporate a lot of those principles. Not everybody wants to do yoga, and I'm not suggesting that everybody should be doing yoga because that's not everybody's cup of tea. But I think there's things that we can take from that and create something that is valuable for you to allow you to breathe better and to get a good long slow breath that helps you to calm your body, which should help with pain and with sleep. So my email is there if you want to reach out to me. You can call the clinic at the number there. Certainly follow us on Instagram or on Facebook for we try to keep up, give some good information on tips and things like that, and to keep in touch with what's coming up next. We do have some other webinars coming in April. Our next one is April 13th. Fit for menopause, which Wendy, one of our pelvic health physiotherapists, is going to be leading, and it should be a really interesting one. There's so much more that we're learning about menopause and how we manage that and how we feel good through menopause. So she's going to bring that information to us. Later in April, in the beginning of May, I'm going to be giving a couple webinars on running, about preventing injuries, and one on what kinds of things should runners be doing for mobility and strength. So, follow us and make sure you keep up to date with what's coming next. And then certainly there's Janet's information if you want to have some more information about what she offers through her sleep coaching. You are on Instagram as well, right? Instagram and Facebook both?
Instagram and Facebook are both at Janet Whalen Coaching. Yes.
Okay. Yeah. Okay. All right. Are there any questions? I know we had a couple earlier, but if there's any other questions that you think of, pop them in the chat or the question box. And if you think of them later on, then please pop me an email and I'll do my best to answer them for you. And I guess if that's it and we don't see any other questions, we're going to say good night, and hopefully everyone will find something relaxing to do for the rest of the evening so that you can have a great sleep. Okay. Oh, there was one that popped up in here. Okay. Does have a question. How do you suggest good sleep with a partner with severe snoring and a CPAP machine that isn't being used? Oh dear.
Yeah. So the CPAP machine that isn't being used you can't control that. Snoring, that's an interesting one. So there's some really good earplugs on the market right now. Oh gosh, I can't remember the name of them. If you want to email me, I will get back to you with the name. Yeah, they're just not coming to my mind. But the other thing I'm going to suggest feels not so great for some people, but I'm going to suggest it anyway. And it's sleeping somewhere else. And what I always say about this, people call it sleep divorce. And I think that's the worst terminology in the world, because one of the best things we can do for our relationships is to sleep well. When we don't sleep well, insomniacs actually don't report feeling tired the next day. They report having like unregulated emotions, feeling angry at partners, yelling at kids, not getting along with coworkers, that kind of thing, right? Because our important connections between our amygdala and our prefrontal cortex are just not happening when we're underslept. And so the best thing we can do for a relationship is actually to have both partners in the relationship sleeping well. And whatever you have to do to make that happen, I think we need to lose some of the stigma around that and really help support each other in actually getting the sleep. So the CPAP machine thing is this is a common one that I hear from mostly women about their husbands not using it. But some people also struggle to sleep with it on because sometimes they can make a little bit of noise, right? So it's either learn to have thoughts like, this is really helpful, this is actually rhythmic, I can go to sleep, this is white noise, I can go to sleep with this. Maybe you need to have a white noise machine for yourself that helps you block out some of those sounds. But then the other part of that is just to think about your thoughts and your feelings about the partner who is not using the CPAP machine, because there might be some resentment that's coming up there that's going to add stress for you. You want to either be able to be okay with whatever they are or aren't doing, or find a way to come to some kind of solution around that. But yeah, support your own sleep as much as you can. Don't feel like you need to suffer because of what's happening with someone else, is always my advice.
Great. That's great advice. Thank you, Janet. And someone just asked, we'll get a link to the recording that they missed the beginning. Yes. And I will have the recording. It'll be up on our website. That will be free too, but I'll make sure to pass it on to all of you who've registered, so that you have it available. Okay. All right. Well, if there are no further questions, I think we are over time. So let's let everybody get ready for a good night's sleep.
Excellent.
Okay. Have
Thanks.
a great night, everybody.